think we should go see the athletic trainer then. This is Matt. He's my star pitcher. He was just throwing the ball during practice, and he came off the mat complaining about low back pain. And he also let me know that he's been having it for a couple of weeks. So I thought I should bring him into you so you can check him out.
Okay, Matt, please have a seat. I'm happy to see you. Okay, so can you just tell me what happened?
Basically, I've just been pitching the past few weeks, and I keep having pain in my lower back. It's really painful, like when I pitch, but then when I rest, it's not as bad. It kind of goes away. But basically, it's just my lower back, kind of like the back of my thighs too.
Okay, and you said it's when you're pitching.
Yeah, most of the time, yeah.
So the pain is alleviated when you're resting?
Yeah.
Okay, do you have pain anywhere else, or is it just localized to your back and your leg?
Just my back and my leg.
Okay, and how long have you been playing baseball?
My whole life.
Okay, and how long have these symptoms been going on for?
Maybe about like a month or so.
So you've been experiencing these symptoms for about a month?
Yeah.
Okay, and you said with pitching?
Mm-hmm.
Okay, have you done any recent changes to your training routines?
No.
No, okay. What have you done to make it better? If you have done anything to make it better.
I tried taking ibuprofen, but it doesn't really help.
Okay. So we're gonna do a few things to assess you. Just gonna do a quick inspection of everything. So she said you've been having some back pain, correct?
Mm-hmm.
And then for about a month or so?
Yeah.
Okay, so do you mind if I have you lay on your stomach and then just check your back real quick just to make sure you don't have any injuries or anything? Okay, so you're just gonna lay down for me. Okay, and then is it okay if I go ahead and raise your shirt?
Yeah.
Okay. Okay, so you don't have any discoloration, and then there isn't any swelling. Have you had any injuries lately to like your back or anything? Okay, and then there's no scars or anything. And then let me see. And then does any of this hurt when I put pressure on it?
No.
Okay. And then, so what we're gonna do, since there's no visible injuries to your back, we're just gonna go ahead and do real quick is just hip height, just to make sure that your hips are matching up at the same height. That could cause some back pain as well. And then we're just gonna make sure that you're walking okay? So if I could just have you stand up. So what I'm gonna do is I'm just gonna measure your hip height right here. So it would be your iliac crest is right here. And then your ASIS is right there. So then just make sure that that levels out, and it does. So you should be fine, and then just backwise, everything measures out correctly. Yep. And then if you don't mind for me, just walk as you would normally right now, and then just want to make sure that you aren't having any stiffness or any pain while walking, that doesn't change your gait pattern at all, okay? Okay. So is it your right leg that's hurting more with the back pain sometimes?
Yeah, it feels a little more stiff.
It feels more stiff. Now what we're gonna go ahead and do is we're just gonna do some palpation. So that just means I'm just gonna go ahead and touch some areas just to make sure you're not experiencing any pain or specific tenderness at those points. Okay, so is it okay if I go ahead and raise your shirt again?
Yep.
Okay, so we're gonna start off is just touching your back just to make sure you're not having any gaps or any special tenderness there. So we're gonna start off is by finding your 12th rib, and then that would match up to your T12, which is on your spine. And then from there, I'm just gonna use that to just palpate the ones located around it, just to make sure. Okay. And then from there, just continuing on your back, we're just gonna do the muscles around it. So it's gonna be the erector spinae muscles. So they're both to the sides of your spine. Are you experiencing any pain?
No.
Okay. Any tenderness or anything?
Mm-mm.
Okay, and how about on this side?
That side's good.
Okay. Okay, and then we're just gonna go ahead and continue and just more to the side, and then those we're gonna do the latissimus dorsi, which is just the muscles that go along your sides, okay? And they go towards your front. Any pain, tenderness there?
Nope.
Okay, no soreness or anything?
Mm-mm.
Okay, and then to continue, we're just gonna go ahead and do some of the lower back regions. So if you have any tenderness or anything, just let me know, okay? Any tenderness there?
Nope.
Okay. And then how about now?
Nope.
Okay. And to finish off, since you said that sometimes your leg hurts, we're just gonna go ahead and continue to your back thighs, okay? Any tenderness there?
No.
Okay, and how about on this side?
I feel a little tight, but it's about it.
Check on Matt's status to see maybe he'd be able to good enough to go back to practice or be able to play for tomorrow's game.
Okay, I understand your concerns, Coach David, but I still need to continue my evaluation with him. So we're going to do some exercises to determine his range of motion, what he's restricted, and where he's receiving pain.
Okay.
All right, Matt. So we're going to do some exercises for you. Okay. So first thing we're going to do, I'm going to have you flex. So can you put your feet together? Can you face this way, please? So all you're going to do is you're just going to flex your body forward. Okay. And come back up. Do you experience any pain?
There's no pain.
No pain. Okay. Now I'm going to do it for you. Okay. Now come back. Okay. Now you're going to do it, and you're going to do it against my resistance. Okay. I'm just going to hold you here, and you're going to try to go into flexion as far as you can. Okay. Good. So do you experience any pain, or do you feel like you could go down further?
No pain, but I don't feel like I could go down as far.
Okay, awesome. Now we're gonna do an extension exercise. So I just need you to lay on the table, have your head facing this way and your feet facing this way. Okay, so with completely flat arms up your sides. So first things first, all I'm gonna have you do is you're just gonna bring your head to your feet. All the way up your back, as far as you can.
That's really painful.
Oh, it is. Okay, awesome. Now I'm gonna do it for you. And let me know if you experience any pain with this.
Yeah, there's still some pain.
Painful?
Yeah.
Okay. Now last test we're gonna do, I'm gonna resist you, and I just need you to do it one more time, okay? Go ahead.
Yeah, it's too painful. I don't
Okay,
think
so
I
you're
can do it.
having painful on all three.
Yeah.
So you let me know if you feel any pain or tenderness or anything around here, okay? So we're gonna start off with the 12th rib, and we're just gonna start with the spinous process. So there does seem to be some extra movement around your spinous process. So we're gonna do other tests just to make sure to rule anything out, okay?
Okay.
And then we're just gonna start off with the side ones. So we're good there. And then if I could go ahead and have you stand up. So we're gonna do a test called the single leg stance. So we're gonna do, and then I'll go ahead and help you to, because it does include a lot of balance. What you're gonna do is you're gonna, since this is more of your affected side and your affected leg, what you're gonna do is you're gonna raise that leg, make sure it's completely bent. And what you're gonna do is you're gonna side bend. So I'm gonna help you. You're gonna side bend, you're gonna kind of rotate this arm to this side, and then you're gonna push back, okay? All at the meantime balancing, and then have your hands at your hip. So you can start off there. So go ahead and raise your leg, okay, there. And then you're gonna side bend, so bend this side to this side. Then you're gonna rotate, so bring this shoulder forward, and then just lean back, okay? And then there, and then we're gonna go ahead and do on the other side. So go ahead, same thing. So you're gonna do that, hands at your hips. So you're gonna bend towards this side. You're gonna rotate, so bring that shoulder more forward, and then you're gonna lean back. Okay, you can go ahead and rest. And then the last one we're gonna do is called the straight leg raise. So what we're gonna do is have you lay on your back. And then this one tests your affected side, so you're saying it's this one. So what you're gonna do is you can just relax, and what you're gonna do is you're gonna try to bring up your leg straight, and then towards the point that you can keep it straight. Once it starts bending, then I'll have you stop, okay? So you can go ahead and raise this one, so go ahead. Okay, so you have a slight bend there. Can you go any farther up? Okay, so it bends. And then go down. And then just one more time, please. Go ahead. Okay, and then down. 3 special tests that I did were the spring test, the single leg stance, and then the straight leg test. So it looks like with the spring test, I did feel like there was an increase in movement between his vertebrae. And then with the single leg stance, he had some pain, especially with the extension part of it. Once I told him to kind of extend back, he felt pain there, not really with the rotation now. But with the straight leg one, he didn't really report any back or...
I was wondering what was the condition with Matt?
Okay, so my assistant athletic trainer, Catherine, she did 3 special tests on him. The spring test came back positive. The single leg stance came back positive. So our working diagnosis is spondylolisthesis for him.
What is that exactly?
So that's basically on your vertebrae in the lumbar region when the vertebrae slips forward interiorly. So that's why he's experiencing pain in his back.
And then what about the pain shooting down his lower leg?
So sometimes when the vertebrae slips forward, it can also compress the nerve. So that's why he's having referred pain in his lower leg as well. So what we're gonna do is I'm gonna discuss with Catherine treatment plan for him, and we're gonna try to get him back on the field.
Is he gonna miss a lot of practices and games?
Well, we're gonna see with the first 3 days our treatment plan, and then we'll go from there, okay? All right, Matt, so since we believe you have spondylolisthesis, me and Catherine have created a treatment plan for you.
So Matt, it looks like you are going to be missing out on the rest of practice today and for the game tomorrow. We recommend that you get at least 3 days of treatment and of rest, and then from there we'll kind of start the treatment plan. So we're going to kind of take a conservative approach to it, and we're going to start off with some stretching and some very light exercises, and then seeing how you continue on that. We'll see what exercises we can do to strengthen your core and help with any back pain. And then from there, we'll kind of see, and we'll see what the timeline's looking for you to return back to normal practice and games and everything, okay?
Just check and see Matt's status and how's he doing?
He's doing better. We did a series, some exercises that he's been doing at home, and he should continue to do. I'll show them. He's going to demonstrate what he's been doing. So Matt, you can sit on the table. We're going to do some stretching and some core strengthening exercises. So he knows to just bring his knees to his chest and to just hold them.
Okay, and these are some exercises he can do on the side since he's not able to play right now?
Yes, and he can do them at home as well.
Okay.
Okay, and then we're going to do some clamshells. So Matt, just lay on your side. Okay, and I'm going to stabilize you here, and you're just going to bring your knee to my chest. Okay, do one more. Okay, and then another stretching technique you can do is the child's pose. You can do the standing or sitting, whatever you prefer. And you're just gonna lean over and you're gonna stretch your back.
What are some things that he should not do to make his condition worse?
So he should not be doing any excessive extension exercises until he's ready to go back to